Hello and welcome. I'm Alan Gregg, one of 38 principals at the Earnscliffe Strategy Group. Those of you who may not know our organization, we're a public affairs strategy company that specializes in government relations, strategic communications, and public opinion research. We're here today to talk about the not-for-profit and charitable sector and the impact that the COVID-19 pandemic is having on that sector. We'll talk about the government response, whether it's adequate and appropriate to meet the needs of the sector, and finally, next steps. Over the last couple of weeks, we've all witnessed an absolute unprecedented tsunami of initiatives out of our governments, federal and provincial, both to support the healthcare system, innovation in the healthcare system, more recently a fiscal stimulus, the likes we've never seen before, in an attempt to kind of freeze the economy so that when we get through this pandemic, that we will have an economic revival that will be more rapid than we saw in 2008, 2009. And then we have within this, the not-for-profit and charitable sector, and often seen as an afterthought. But this is a sector that represents almost $170 billion, 8.5% of our GDP, 2.4 million workers. What's happening in the sector on the ground? How are they being impacted by this pandemic? What are their needs? I'm joined today by some of my colleagues and a special guest, Nikki Hill, is the principal of the Earnscliffe Strategy Group out of Vancouver. Rick Anderson, another principal who shares his time between Vancouver and Ottawa. Marianne Carter, principal at Earnscliffe Strategy Group out of the Ottawa office. And our special guest, Andrea Dix, who is the president and CEO of the Canadian Community Foundations. Andrea, if there's anyone in the audience there who doesn't know your organization, it's quite remarkable. Why don't we just start with you and just tell us a little bit about what you do for folks right across the country.
Thanks so much, Alan, and good afternoon, good morning to everyone, wherever you are joining us from. I work for Community Foundations of Canada, which is the national leadership organization for Canada's 191 community foundations. So whether you're on Vancouver Island, whether you're out on the East Coast, whether you're in a rural community or an urban community in Canada's north or in the south, the likelihood that there is a community foundation working hard on the ground to support the charitable and not-for-profit sector is quite significant. There's 191 here in Canada, and there are more all around the world. So community foundations are not only a Canadian movement, they are a global movement. 1,900 community foundations around the world. Here in Canada, we will be celebrating 100 years of community foundations next year in 2021. And community foundations in your community do a variety of things, from grant making to convening to community leadership to engaging donors, supporting the not-for-profit and charitable sector. They're connected to social service organizations, environmental organizations, arts and culture organizations, and every other element of the charitable sector.
I want to start with the conversation with Nikki. I mentioned in the introductory remarks that that maybe the charitable not-for-profit sector isn't top of mind or top priority for government and government response. Clearly, they're very concerned about the economy. Maybe they don't think that sector is central to the economy. Is that premise right? I mean, is the not-for-profit sector a priority for government today?
Yeah, I mean, I think there's, definitely in this, as you say, unprecedented time, there's been some attention to the nonprofit and charitable sector to start with, except from, working with stakeholders and working with people who are putting their hands up and saying they want to help from the sector, it certainly does seem like something that government's seeing as a, in the couple weeks from now, when we get through this initial stage of urgency and ensure that people are still working. I think one of the biggest pieces is the diversity of this sector. There's no real one service provider, or there's so many people who are doing frontline services that are extremely critical right now, at the same time as there are other organizations and leaders who are working in equally valuable sectors such as arts, pieces we want to keep going through recovery, but governments may be have a more tendency right now to start with those who are actually able to help mitigate some of the risk to people who are already at risk in our communities, working with a really important demographics like seniors, youth in care, to make sure that their lives are not becoming more at risk in the weeks to come, which does mean that I think some gaps are forming in what the charitable response needs to be sort of across the country.
I want to get to that, whether there's a one-size-fit-all policy response, or there has to be more of a boutique and pointed initiatives. But first, Andrea, you talked about 191 community-based charitable organizations, huge and tiny. What's happening on the ground? How is this pandemic affecting your membership?
Well, maybe I'll first just start with a comment about the charitable and not-for-profit sector more broadly. And our colleagues at Imagine Canada have done a tremendous amount of analysis and work to understand what the implication will be on the charitable and not-for-profit sector. And so we're seeing numbers of revenue loss projections between $9.5 and $15.7 billion. We're seeing projections of layoffs of employees of 117,000 upwards to close to 200,000 Canadians. And that's just projections. What we're already witnessing is a fairly stark situation for communities, and that's service interruptions and closures of charities and nonprofits. It's, as I mentioned, layoffs, not only active layoffs, but anticipatory layoffs are happening as well, we know, across the sector. There's the cancellation of major fundraising events, which of course, impacts the way in which charities and nonprofits are able to do their work. There's programming activities that are being canceled. And we know, in fact, that there are also organizations who are now exploring bankruptcy. So that's what's happening across the charitable and not-for-profit sector. And as community foundations, what we are seeing is that community foundations are, of course, themselves reflecting on what this means for their operations. Many community foundations follow the endowment model, which means that their investments are in the markets, which of course are extremely volatile. And I think it would be understandable for the first response to be a protectionist one when it comes to assets like that. But what we are actually seeing are community foundations and other philanthropic foundations step forward and lean into a response to support community, to support the charitable and not-for-profit sector. And so that means that they're opening their toolbox and they're using all the tools in their toolbox, whether it's grant making, whether it's impact investments, whether it's their voice and the platform and the role that they hold in community, bringing people together, convening, leveraging the relationships that they have, all with an effort to ensure that the charitable and not-for-profit sector is can really continue. And so there's a reflection that's happening right now of, not only can we look at the tools that we have easily accessible, but how can we also look at new tools and build new tools so that the charitable and not-for-profit sector can be sustainable as we move forward. I think there's a recognition that this is an extraordinary moment, and an extraordinary moment like this requires an extraordinary response. And so we're hopeful that that's coming through with the government, and early signals seem to be that way. But we're also seeing it in the way in which private philanthropy and community philanthropy is really stepping forward to be extraordinary themselves.
Marianne, notwithstanding those heroic efforts, you heard Andrea talk off the top about how much this is debilitating the sector. Mm-hmm. You've got a lot of health-based charitable clients. What are you hearing from them? How are they changing their behavior? What are they doing in this particular circumstance?
Well, during this crisis, health charities are inevitably most impacted. They are feeling it firsthand as patient organizations become heavily relied on as the healthcare system and infrastructure is strained due to COVID-19. So inevitably, patient groups are relying heavily on these organizations for all types of services and support when the healthcare system is overburdened. To build off of Nikki and Andrea's points, whether they're small charities or large organizations that we all know, they're talking about losing hundreds of millions of dollars in fundraising initiatives that are critical for research and projects they had planned for the upcoming fiscal year. There's so much they don't know in terms of the anticipatory layoffs, like Andrea has mentioned, and they're grappling to understand how they can support people who have already compromised immune systems. And taking it further, we talk a lot about patient groups, but there's also lots of people out there living with disability as well who rely on a lot of these support services, whether it's driving certain patients to their appointments that are now canceled or postponing surgeries. And so the reality of what they're hearing or feeling right now is quite intense. But that said, they are trying to be extremely creative. I know because I work with so many of these organizations who are trying to pivot to be unique in their advocacy by engaging virtually, providing real-time feedback to government networks, and coming together collectively to discuss, not just daily, but almost hourly on suggestions that they can put forward to ensure that we come out on top of this in a positive footing.
Oh, I want to ask a supplementary there, because I mean, the double tragedy here, and especially in the health sector, is that not only is the pandemic having a terrible impact on their infrastructure, operations, and fundraising, but at no time have we needed civil society more to help manage this pandemic. The very resource that we could be deploying is being crippled. Does government get that?
I think government understands that, but I think there is still a lot to unpack, and I'm hoping we will see more of that in the coming days. So much that what we've been hearing in the last week or so has really been focused on business. And right away, a lot of clients I've worked with and organizations I'm in touch with have said, well, does this apply to nonprofits or charities? Or we get partial government funding. Does that mean we're eligible? Or do they understand that our revenues are primarily generated in Q3 and Q4, and we're supposed to generate a 30% revenue anticipatory model when we don't know? So there's these sorts of things where it's not a one-size-fit-all model that I think the government has to better understand, and I think they're working quite hard to understand. I know this week they've asked for a lot of feedback and facilitated calls through various departments to ensure that they're understanding the needs of these grassroots organizations that are helping civil society.
Well, Rick, I want you to add on that. I mean, you've been following public policy for decades. I mean, what's your assessment of the government's response? You're muted, Rick. Rick, you're muted.
Right. Morning, everybody.
Old white man of a particular generation. What can you say?
You know, I haven't lived through the Depression of World War II, so I can't.
You're muted again, Rick.
Okay, there we go. Not having lived through World War II and the Depression, I can't use a personal reference point with respect to those public policy responses. This is probably in that scale. I have been through, 9/11, like everybody else on this call, and the ice storm, where 4 million people were without food, heat, communication services, blah, blah, blah. So those are sort of the only comparators most of us personally have. This is a bigger public policy response. It involves all three levels of government. They move very, very, very quickly to confront what is not just one crisis, but two: the healthcare crisis, which is the most urgent and pressing, and the resulting, the economic crisis, which is resulting from the measures that are being taken to defeat the pandemic. And so across the whole of governments, as the term that they use, not just at one level, but all three levels, we see everybody swinging into action from the front lines on the healthcare side of it to all the support mechanisms within government. So, for government, the response is remarkably agile. That is an important qualifier. Governments are big organizations with multiple internal and external stakeholders. They don't move quickly, but by their usual standards, they're moving extremely quickly and for the most part, quite effectively. And the other thing that's pertinent to this conversation is they understand no matter how much scale government is bringing to the response, it's not enough for the crisis, the two crises that we're in, and they need to leverage civil society, the not-for-profit sector, the industrial sector. Basically, every part of society has a role to play in addressing these crises.
Andrea, I mean, there's no question that the level of government activity is head spinning. But in terms of the not-for-profit, it seems a little lumpy. I mean, you're an hourly conversation, you and your colleagues, with government right now. When they announced 2 days ago the wage and financial subsidy, they said, well, we have to talk more to the not-for-profit to make sure this applies to them. Bruno said, in addition, we have to have some special initiatives for the not-for-profit sector above and beyond what we've done for business generally. What's the diagnosis at this particular point in time? Is there a growing consensus in terms of what is, if not the panacea, certainly the formula for government support of the not-for-profit sector?
A great question, and certainly many conversations happening around that. I think there's a few other announcements that government has made that I just want to highlight also that's important to the sector. So that's the deferral of the T3010 filing. It's the deferral of GST and HST remittance.
Explain the T34.
The T3010 filing is the annual filing that charities have to do. So they've extended the deadline because people are on the ground doing the work that they need to do. And so there's some leniency that's being provided associated with that. There was a loan program that was announced in which was available to business as well as to the charitable and not-for-profit sector. There's the work sharing program. And then there's what you referenced, which is the wage subsidy program, which, yes, we're still waiting for some technical guidance around how that pertains to the charitable and not-for-profit sector. The good news is that there's many conversations between government and the charitable and not-for-profit sector about how to construct this in a way that works well for everyone with accountabilities in place. Marianne brought up many great points about the different ways in which charities and nonprofits operate and therefore are going to respond to the wage subsidy in a different manner. So there's lots of considerations and many layers to those considerations. I think in terms of going forward, and of course this pertains to the analysis of the wage subsidy, but it's really important that we offer support to keep people employed. So we're figuring out the subsidy collaboratively, but there's going to be other mechanisms as well that need to help keep people employed. There's support that's required for organizations to remain operational, paying the rent, paying the mortgage, paying the utilities. We have large institutions in which aren't currently being used, but the cost still remains. And then of course there's support for increased services on the ground for vulnerable populations, for the essential services, again, what Marianne was referencing earlier. And the underlying message about how we do this, how do we do it in an equitable way also, recognizing that we're really grappling with unique circumstances across many organizations and many communities.
Alan, we have a question that's relevant right now, if that's okay.
Sure, absolutely.
Can Andrea speak more to the work share program that she mentioned is available to the charitable and non-for-profit sector?
Maybe what we could do is we could send a follow-up note with the links to each of these. I'll be very honest, I don't know them well enough to speak to them in detail, but we can send the links out so that everyone has access to that.
Sounds great.
Great.
Nikki, the sector is not full of wilting violets. I mean, we have seen an aggressive campaign by Imagine Canada. Samantha Nutt, old friend in War Child, has also put her hand up with many behind her and trying to put forward asks that the not-for-profit sector has asked for a long time.
Mm-hmm.
Is this an opportunity for the not-for-profit sector to get on a whole different footing in terms of the public policy foundation that would make them strong coming out of this?
Yeah, I definitely think there's been, pretty quick, well-coordinated effort by some of the large coalitions or large representative groups across the country to start pushing government down that path of thinking about what the long-term policy changes are that are needed. So, it's not just asking for a government to look at setting up pools for grants for nonprofits to keep people afloat. It is also looking at what kind of policy systems are in place right now that are hampering nonprofits' ability to function. And how, some of those, having run a nonprofit myself in the past, I remember how onerous some of these systems are. And so when you're actually in a crisis and trying to help people on the ground, having to, go back and go through some of the tax measures and some of the charitable CRA issues you need to go through as an organization at the same time as making sure you're feeding people or making sure you're keeping programs running. Those all, I think, need to be addressed. And I think we're seeing, not just in the nonprofit sector, but across government policy, certainly here in BC, policies that people had been asking for the past couple years, whether it was increased to disability assistance rates, which changed yesterday. Now is really the time where that is getting the support from the public and a deepened understanding of why those policies have been called for advocacy groups. Unfortunately, it sometimes takes this sort of crisis to be able to make those moves, but there certainly are a large number of policies that are moving quickly into becoming, if not just short-term measures, hopefully long-term policy change that will actually help nonprofits function.
The government has promised that it would entertain the unique differences in the not-for-profit sector on things like the wage subsidy program. One of you mentioned that a lot of fundraising is in Q3 and 4, and that they're looking for a comparative of a 30% decrease in revenue in Q1, which wouldn't apply. So that's all good. But they've also said there's going to be additional initiatives that are put forward. We heard an announcement today, fairly significant funding for food banks because of the urgency of that particular sector. What is the single thing the government could do for the not-for-profit sector that would have the greatest impact, ensuring that they can survive this crisis and emerge strong out of the other end? Rick, I want to start with you. I want to go right around the table. What's the single thing?
Well, I imagine that, like most organizations, it's what is called liquidity, making sure that cash is continuing to flow and that people don't close the doors because of a shortage of cash in the middle of this. So keeping people, governments are starting to talk about building a bridge from where we were to coming out the other side of this thing. They want people to survive. For most organizations, that's liquidity in some form. For individuals, it's income support, such as the emergency benefit, and for organizations, the wage subsidy that we've been talking about. So I think it's liquidity. But the other way, Alan, to ask that question, I think, and particularly pertinent to the not-for-profit sector, is what does government need that we can do for that, for society as a whole? Now, obviously, feeding people in the healthcare crisis are two of those, shelter, et cetera, et cetera. But, the more people can take a look at what's going on around government and see where the shortages of help are, the shortages of materials and so on, anything that anybody, if you've got volunteers that can be put to work on something other than what they usually do, that would be responsive to one of the urgent needs. Government has got the doors wide open, and they're saying to the private sector, to society as a whole, if you've got ideas about how to help alleviate some of these immediate short-term problems, or the medium-term problems, or the path towards recovery, which people are starting to talk about as well, then bring them forward now. And practical help is, ideas are important, and practical help is urgent.
I want to get there, but first I want to continue along this line of questioning. And again, Mary Ann, if you were in charge, if you were the Prime Minister, what was the single thing you would do to help your clients?
Well, I think one thing that I've seen that I think started yesterday that's most critical is hearing from those people that are the frontline workers in this. What we've seen to date is a lot of broad, grandiose, we understand, but it needs to really get down into the tactical micro-targeting of what these organizations need. And we have seen, and with the food banks and helping shelters and organizations like these, but there actually needs to be a more strategic short-term, medium-term, long-term strategy and prioritizing the urgent needs versus how can we roll some of these things out. And that has to start by coalescing these groups and getting these things, these details really prioritized. And right now that's just starting to happen. And in my view, that's the most urgent thing to ensure they're delivering on what these organizations really need.
Andrea, the Prime Minister says, I hear you, I feel for you, but I can only do one thing for you. What are you going to ask him to do?
I'm going to hop on the same train as Rick. I think it's about support, funding to keep organizations operational and Canadians employed.
Canadians in the not-for-profit sector.
Yeah, absolutely.
Nikki, you said, you ran a not-for-profit. You know, if there was only one thing that you could change in terms of the public policy environment affecting your organization when you were running it, what would it be?
You know, I think touching, you know, one of the things I think, I'm going to say two. One is just, I think we're seeing some changes in the last couple of days on language, but nonprofits are employers. We don't need to carve people's policies up in terms of, you know, small business, medium business. They're employers. They not only they have staff, they have the same systems and operations to keep functioning. But I think really the shift needs to happen in terms of looking at the sector as partners as well. And you know, nonprofits provide some of the most innovative public policy solutions that exist right now. And so opening up those channels to ensure that the Prime Minister and others can actually hear as we get through this crisis what people are doing on the ground to really shift. Because I think, you know, I'm sure we'll talk about volunteers shortly, but I think there's so much innovation and so much grassroots activity happening to address COVID right now. And that partnership with nonprofits, not as a, you know, a sector that's just coming looking for money. Sometimes politicians have that perception, but really a sector that's making a difference daily, whether government's there with them right now or not.
We've got about 250 participants in this webinar right now, and a lot of questions are coming in. Marianne, you're trying as best you can to both listen and read. Anything there that you think that we should be talking to the panel?
Yeah, a lot of questions, and we'll try and address them given the time. But one important question here, Alan, what are you hearing from donors? Given the economic situation, are they holding off all donations, or do you see commitment from donors to continue giving?
Andrea, you want to take that? I mean, that's one of the questions
Sure.
I asked later on. Good one.
Sure. I think that I just want to distinguish between donors and funders. I mean, both are equally important. There was a piece that was co-written by Community Foundations of Canada, Philanthropic Foundations of Canada, The Circle, and Environmental Funders of Canada that was rolled out last week. It's on our website, and I'll pop a link in. But it's 5 guidelines for funders, and this is what I was speaking to earlier, of funders leaning into support even more. So granting more money, providing more guidance, providing more opportunity for convening, for leadership to the charitable and not-for-profit sector. With respect to individual donors, what I am hearing is that honest conversations, transparent conversations are really important. Donors want to know what the organizations that they support are going through. There's ways to have those conversations in a thoughtful manner that brings people into the conversation of seeking solutions. They know of the important work that these organizations do. They certainly want to be kept informed of what this pandemic experience means for the organization and for the people that organization is serving.
Just anecdotally, is there any sense that within the funder community that there is a phenomena of saying, now I need to support the system more than ever before, or is there a retrenchment going on? Any sense?
Everything that I'm hearing is our communities need us now more than ever.
From the funder community.
Yeah, and the actions that we are seeing from private philanthropy, from community foundations, from other foundations is really leaning into that space of, you know, if there was ever a moment to unlock everything, if there was ever a moment to pull out all the ideas and all the stops, this is that moment.
you know, it sounds a little Pollyannish, but this is a theme we're hearing again and again and again. We will come out of this very different, including with a very different sense of priorities than we had in the past. Marianne, you talked about the need for a more pointed strategy, and Nikki talked about, you know, the needs of the different parts of the not-for-profit sector is very, very different. Should government be triaging its approach by saying, for example, that the healthcare sector is more important than arts and culture? Or do they have to look at a kind of a whole of sector approach to what they're doing right now?
Look, I don't think this is a time necessarily to be picking favorites, because so many of these organizations and this sector is very interconnected. And one of the things we have been seeing that's coming out of this, and it goes past the health charity piece, is the mental health component through self-isolation. And, you know, there's lots of organizations like arts that help in these types of times. And I think the real solution here, as Andrea brought up before, is that we have to look at this holistically. One person pointed out to me this morning, actually, we don't have a distinct minister for the non-for-profit sector like we do for small business. And I thought that was a really interesting point. I never really thought about it that way before, where you have lots of different non-for-profit and charitable organizations that fit into 7, 8, 9 departments. And it's a kind of a mishmash of support programs and things that can help them. And it's not as easy to sort of navigate what is a priority and what is not. So I think, as I mentioned before, looking at this in a more, I would think a better way to do this is prioritizing certain issues and urgent needs versus hitting one sector within the non-for-profit space over another.
Nikki, can you on this question?
I would not use the term.
To Nikki, go ahead.
Yeah, I mean, I think we can already see where there's triaging, and I think we've noted it. You know, programs sort of needed to quickly get to some people who we know are going to have challenges self-isolating. So, you know, we've seen the seniors programs roll out, come pretty quickly. We've certainly seen it here in BC for program expansions with United Way, nationally as well, seniors programs. Those are, you know, that really is the triaging going on to make sure that those people who we know, if they go out in community, are, you know, exposing themselves right now to illness. So I don't think it's necessarily picking as much as trying to figure out how to decrease the impact of the pandemic. I think, you know, in the next stage is going to need to be governments figuring out who, as you know, as our health officers are doing right now, what are the other sectors that we need to be helping? What are those other demographics? You know, obviously homeless people, another huge portion, our city of Vancouver, BC government, in addition here, huge amount of attention to how do we help people on the downtown east side of Vancouver, which is, you know, one of the most impoverished communities in Canada, self-isolate if they need to. So, you know, that's where, when we're talking triage in the pure sense of the word, that's what's happening right now. As we talk recovery, though, you know, that's when we're already starting to hear conversations about that important role that arts plays, that role that tourism plays, that those long-term needs. But I think, you know, governments are right now trying to address some pretty critical immediate needs. I think one thing as well, though, a real job of the nonprofit sector that we've touched on is to make sure government understands what those gaps are. So where we're working with stakeholders, for example, who are seeing they naturally already have infrastructure set up to help their health clientele base with mental health issues, but all of a sudden those lines are being flooded because people can't go and have their surgeries right now. Their mental health is at risk because they're home and they're waiting to figure out what their cancer treatment's going to look like. And, you know, we're seeing incredible surges across the sector in some of those service needs, and which will next obviously need to be addressed in the near term as well, because they're going to cause some pretty ongoing long-term challenges. I mean, we do here in BC have a Ministry of Mental Health and Addictions. I know that they're casting an eye out to how they help the sector in that way. So there's a lot of work going on to help people, but nonprofits are the ones who can put their hand up and say, here's where gaps are emerging quickly that you may just can't see when you're in government.
Sorry, Rick, I interrupted you. You wanted to add to that?
Yeah, just to echo the theme and to sort of summarize it a little bit, the government will look at the not-for-profit sector and see multiple benefits. As I was saying, they first of all want your organization to succeed, so they're prepared to support, provide liquidity, cash, to help you do that. Secondly, if that also can alleviate the unemployment crisis, which is developing, it probably tripled overnight in Canada, maybe quadrupled in the United States. If it can keep people working, that's a dollar or a form of support that's doing two things: keeping the organization alive and also helping individuals maintain an income support. But third, if your organization, if your people can do anything at all to alleviate the emergency on the healthcare side, whether that's supporting healthcare workers, whether it's supporting providing food to people, which of course you do. Can you lock arms with restaurants, small businesses which are struggling? Can you lock arms with the food processing sector, who also want to keep working and keep their people working? Can you lock arms with hotels as part of the shelter and homelessness problem? Can you take your organization and help it not just survive and employ people, but specifically support, using your imagination, the things that people are having shortages of: food, shelter, et cetera, et cetera.
Andrea, is this part of the conversation you're having with government? Is government asking you and asking the Imagine folks, asking the United Way folks, we need your help and this is what we want you to do? Is that part of what's going on right now?
Yeah, those are the conversations that we're part of. It's a mutual solution seeking opportunity for government, for the charitable sector to come together and put the wisdom of the collective group to find solutions. So I know there's been lots of consultation that's been happening across the charitable and not-for-profit sector as these solutions are navigated.
Nikki, again, not only you've worked in the not-for-profit sector, you're very much in touch with the community activists sector. We know that the cornerstone of charitable giving and charitableness is volunteering. How do you mobilize volunteers in a period of isolation and distancing?
Yeah, I actually, we're in a crisis, and I'm sure, I know for all of us, there are days where this has been really tough to get through, even as individuals, let alone as sectors or workers. I feel really lucky to be working with a lot of stakeholders who are working with volunteers, and to be able to see the incredible response that people are giving in their communities and neighborhood to want to step up. In fact, I would start to argue pretty soon that there's probably more volunteers putting their hands up, wanting to step into roles to specifically help their neighbors, than there's gaps to fill that are being identified right now. So it's exciting, and I think we saw some recent similar stats out of the UK, where they set up a helpline and it was flooded right away. Here in BC, we've had some similar results where some additional government funding went into a BC 211, and people immediately started calling on the second it was announced to say they wanted to help, whether that was bringing groceries to a senior or walking a dog, or the organic nature of how people have been setting out. I've seen friends set up spreadsheets to help their specific neighborhood and say what they can offer, or I'm going to the grocery store, is there any seniors that I need to bring something back to in my community? So nonprofits have this ability to mobilize people in a way in which government just doesn't. And I think that's a huge piece moving ahead, as long as you can maintain all the very safety rules that we have in terms of physical distancing and listening to what our health officials are telling us. There are so many jobs that can still be happening to support people. And again, there's a great program here called Hi Neighbor in BC, where it's literally neighbors dropping off postcards for each other with United Way that say, do you need anything? And then that postcard goes back in the mailbox and someone picks it up, and that person has said, yeah, I'm here on my own, or I'm a senior, or I'm someone with a disability and I need some help from my neighbors, and it's happening. So
Well,
It's exciting.
talk about a way to legitimize your importance to society, you know, to be able to mobilize those kind of volunteers.
Yeah.
Not unrelated to this, Marianne, I mean, a lot of not-for-profit organizations use events to raise money, whether they're walks or concerts or what have you. Those aren't happening anymore either. Do you see anything really innovative happening out in the space right now where people say, well, I can't have public gatherings, but I'm going to use XYZ platform to try to create the same kind of effect?
Yeah, and this touches on, there's so many questions flooding in, I should say, Alan. A participant has asked that very question. And one innovative idea that I have seen that has raised a lot of money is a video game competition. And there's just using virtual technologies and different things to pivot to engage people in a unique setting, despite, you know, not being able to meet in person. And it was actually quite successful, and they were able to raise some money. And I think, you know, we don't have all the answers right now, but there is going to have to be some virtual creative solutions going forward, whether it's doing panel discussions or engagement in different types of events. We've seen people do these sort of unique gala formats where they're going via teleconference or video conference rather, in a ball gown and sitting on their couch and in donating money in some way. So, you know, it's not the most ideal situation, but people are trying to have fun and make the best of it and ensure these organizations stay alive.
Andrea, same question to you. Do you see anything that's really kind of innovative and fun happening with your members right now in terms of how they're trying to maneuver all the obvious obstacles that are in front of them?
I really like those ideas that Marianne shared about fundraisers. We're seeing in foundations, in community foundations, we're seeing a lot of emergency response funds being created so that the community foundation can be a vehicle for funds to be distributed into the community. We're seeing local coalitions that are being built between the community foundations, the local United Ways, and other actors who are coming together to provide support that's financial, as well as resources that might be more in the space of consulting or gathering for their organizations and for their community. And then we're seeing a lot of foundations step into the space of supporting with grants vulnerable populations or those who are experiencing isolation in a different way. There's a great story out of the Community Foundation in PEI who has made an investment in securing tablets for all seniors across the province, recognizing that seniors are some of the most vulnerable when it comes to COVID-19, but are also experiencing isolation in a different way. So lots of creativity, I would say.
Now, we were scheduled to only do 45 minutes here, but I see that we've still got well over 200 people tuned in. And Marianne, you got any questions there that you want to prompt?
Yeah, there's several questions, and it's hard to prioritize, but I think this is a good one given the industry we're discussing. How should or can larger member-based charities and not-for-profits leverage their local members to make their voices and concerns heard by governments in this context of the COVID crisis?
Constituency mobilization. We know something about that, Nikki.
Yeah, we do. I think, you know, it's a tricky space right now to try to get attention from governments who are also essentially in a crisis mode, trying to, you know, keep us all safe. I think that
expand on that. I think that's a very interesting and important point. I mean, the last thing you want to be is an irritant right now.
Yeah, so I think, you know, there's ways to still very much promote. I think that one thing I've always observed doing a mix of politics and nonprofits in my life is, you know, nonprofits spend a lot of time and charities spend a lot of time talking to donors about impact of what they do and crafting stories about who they're actually helping and the exact child or the exact family. And yet when they're dealing with government, those stories don't level up. They don't tell. I always tell my clients to, you know, talk to elected officials the same way they talk to a donor. That use that human touch. So absolutely, I would say instead of, you know, that focus on we need $1 million from government. It's that storytelling about who's impacted when you don't have that $1 million. You know, which kid isn't going to get help, which person who needs access to mental health programs. Like, telling some of those stories is so important, and having your members and your supporters do that, I think, is far more important than, you know, sending a letter into government asking them for funds from, you know, one of your board members. Quite frankly, it's story, story, story. Make government understand what's at risk and who needs help in a very personal way.
Rick, we've run hundreds of campaigns, advocacy campaigns. What would be your advice right now for the not-for-profit sector in terms of approaching government?
Well, like I was saying, you know, if you've got a critical need in terms of survival or something, you have to reinforce your role in society and also create a sense of urgency about the survival of your organization. So let's not lose sight of that. But also, if there's something you are contributing to the front lines of the health, homeless, food, employment crises, make those points clearly. If there's something you can do that you're not yet being asked to do, come to the table with it. I mean, just volunteer. You know, we're really talking about the not-for-profit sector, but the other side of this is it's also the voluntary sector. You know, and while we have to keep our distance from each other, volunteers can still make material contributions to this exercise.
Marianne, what's the best advice you're giving your clients today?
You know, we always go back to the grassroots of, you know, when you're running a political campaign of door knocking and letter writing. And one thing that the non-for-profit sector is extremely good at is mobilizing their members and voices and numbers. So I think any type of campaign to get it on the radar via letter writing, via, you know, social media is so prevalent now. Doing any sort of digital campaign to bring awareness to some of these issues, particularly when we're talking about patient groups who are, you know, already, you know, have compromised immune systems and feel like they're, you know, have dropped down in terms of priority for the government right now. So I think any sort of way to be creative through those channels, it doesn't take much to mobilize the members just to write a letter. And you'd be surprised how much 200 letters could do to make a vast policy change.
Andrea, last word to you. My guess would probably be that 90% of the people who are on this webinar are in the not-for-profit sector. What's your best piece of advice to them?
Well, at CFC, we think of a community that is in crisis with 3 mile markers. So there's response, recovery, and rebuild. And we are clearly in the response moment and will be for a while. And that should, of course, be the emphasis. But we can't take our eyes off of the future while responding. And so I think for a question that we're holding on to right now is, what does that future look like? When we get into the rebuild mode, are we rebuilding the status quo? I hope not. I think the status quo isn't working for many people. And so what are the thoughtful resets that we can consider now so that we are being intentional about the future that we want to steward collectively? So that would be maybe not good advice, but just something else to think about in the space of many other conversations that are being had.
Oh, extremely well said. On behalf of our entire team at Earnscliffe, I want to thank everyone who's tuned in. It's been a great conversation. We're in difficult times, and the change is, as I say, head spinning. So all of you be safe out there. I want to give special thanks to Andrea Dix. It's really good to have a non-Earnscliffe perspective on an Earnscliffe platform, and we hopefully will have many occasions again in the future. So on behalf of everyone, thank you so much, and stay safe. Bye-bye.